Hi, my name is Joe Legrand. If you watched my first video, you learned a little bit about drug terminologies, RxNorm specifically, how it has different hierarchies, levels of IDs or Rx CUIs for medication products, going from multiple ingredient down to single ingredient, dose form, strength information. So with this video, I want to kind of expand on that, give an example of a use case for RxNorm relating to EHR, and also to introduce RxClass, which is another NIH NLM hosted source of information about drugs, which has a lot of different drug classifications and groupings that you might use in your work. So we're going to use this board again as a way to walk through the process. So we'll go ahead and get started. So this is the example I came up with to walk through. So this is the question is, let's find all patients who have more than one ACE inhibitor on their med list. Thought this might be useful because typically patients don't have more than one, and if they do, it might be a good chance to look further into the patient's chart, see if it's an error or if it's appropriate. So two questions: what is an ACE inhibitor? So how do we define that? How do we know which medications are ACE inhibitor products? And then how do we know if a medication product contains an ACE inhibitor is the second part. So the first question about what's an ACE inhibitor, you could ask a pharmacist, ask a physician, or anybody, how do you define ACE inhibitor? It's one way. Your EHR might have a grouper of things that are considered ACE inhibitors. You could look on a drug information source, to see how that is defined. But the way that I usually start off with something like this is I'll reach for RxClass. And so this is what RxClass looks like. It's an NIH NLM resource. There's lots of different types of classifications over here. So ATC is one. There's a few sources from DailyMed, which is a really valuable resource of drug information from the FDA. MESH, SNOMED has some down here, VA. So you can browse these individually and kind of navigate through the tree, or you can just kind of search for what you're looking for. So in this case, ACE inhibitor. And you can see of the sources on the left, it pulls a couple of them, and you sometimes have to play with them to see which one works the best for your purposes. This one is a DailyMed source that I tend to like, and so you can see what it gives you is a list of ingredients. So remember, with the TTY or turn type of IN, that is a single ingredient code. So all of these are single ingredient codes of things that are considered ACE inhibitor products. So that's how we could start off with defining what an ACE inhibitor is, potentially for this example. We'll come back to this in a little bit. I just wanted to show you how you can get this information. So how do we know if a medication product contains an ACE inhibitor is the next part of this challenge. So looking at one patient's med list, obviously we look at the whole chart and do some sort of a query to get this information, but one at a time. This is one patient's list. We can see this list has a lot of things that might prevent free text search from working just by searching by the names of those products. So there's combination products. There's inconsistent formatting. So sometimes there's a dash, sometimes there's a hyphen. And then there's medical shorthand like APAP instead of acetaminophen. Most EHRs normalize and standardize this stuff, but there's always room for human error and things like that. So the best way to do this would be by using some sort of a structured search. The med list contains, it is basically built in our EHR using medication records. In Epic, those are called ERXs. But our EHR has mappings that will take those EHR medication records and map them to RxNorm concepts. So we can get from the med list to a list of RxNorm concepts that represent those products. And just like we said in the last presentation, some of those products can have multiple ingredients that then get broken down into single ingredients. Other products can have just a single ingredient that represents the single ingredient. So it just depends, but to account for both of them, it's best to take that two-step approach and break it down into the list of individual ingredients that are contained in that product. So once we have that list of individual ingredients that's contained in all of the meds in the med list, we can go back to that RxClass list, which, flipping back to this tab, is the same thing, only in a different table. And you can see then, or do this with a SQL query, that two of the ingredients in this list match the ingredients on the patient's chart. So this patient does have multiple ingredients. So this is just one way that we can use RxNorm to do a search.